Good evening, good evening, good evening. Welcome to Couch Conversations with the Doctors, where health is wealth. What night is it tonight? It is Monday night. And what is Monday night? Monday night is Couch Conversations with the Doctors. So we thank you guys for being here. We want to remind you to share, continue to share these videos so you can make sure that you begin to share life with others. I'm going to ask if everybody would mute so we can make sure that we can hear everybody as we speak really quickly. Thank you so very much. And as I call on you, you can unmute and introduce yourself. We're going to go around the great panel as we always do. And we're going to introduce all of our esteemed panelists and our special guests that are here with us on this evening. I'm going to start with art connoisseur, the man who can really tell you all about art, among other things. That's our very own Joe Harrington. Joe.
Thank you, Nikki. It's a pleasure to be here, and it's great to be here not only with colleagues but with good friends. My background is mostly in healthcare and public health. I retired in 2017 from the Illinois Department of Public Health, where I was the regional health officer for Cook County and also served as an administrative law judge.
Outstanding. To my colleague and co-worker who usually leaves me in the wintertime for sun and fun and go to a warm climate, but he's always back. That's our very own Dr. Douglas Graham. Dr. Graham.
Hey, Nikki, there's room at the inn if you get too cold in Chicago. You're welcome to come out west. So I'm a retired physician. I worked in the western suburbs for about 30 years and spent 2 years working with the representative in his office in Washington, D.C. Great experience. It's a real honor and a treat to be here tonight. I'll try and answer your questions if I can.
Outstanding. To the man who says that I threaten him to be here every Monday, but he is always on time, that's our very own Dr. James Miller. Dr. Miller.
Good evening, everybody. Glad to be back. Been off a couple of weeks. Thought I'd squeeze the last warmth out of the year before the winter weather started rolling in and looked like I just made it. So glad to be back. I'm a retired physician. I retired from clinical practice in 2019 as an internist. And I'm glad to be in this setting with my esteemed colleague. And we hope that we'll be able to provide some information and help somebody gain better knowledge of how they can be healthier.
Outstanding. And thank you so much. The urologist to the stars, who is mobile right now, but he is still right here with us. That's our very.
Well, thank you very much for that kind introduction, Nikki. I really appreciate this opportunity to be on this panel, and especially with my esteemed colleagues, and notably Dr. Eric Whitaker, a man who I've known for a long time that has done some amazing work putting together an amazing company, Zing Health. And we're going to get into that more. And of course, Miss Selvey, she is the smartest woman I know in terms of this whole Medicare thing. So whatever she says, that's right. And she is just amazing. And Dr. Whitaker has assembled a wonderful team of people. And I'm grateful to be on this panel with you and everyone else tonight, my esteemed colleagues. So I look forward to a wonderfully robust conversation.
Outstanding. To that weight loss family practice medicine who really thinks he's the Wolfgang Puck of food. That's our very own Dr. Tony Hampton. Dr. Hampton?
All right, Nikki, thank you for the opportunity to join you guys again. I'm really excited about expanding our minds, understanding healthcare from all perspectives. I think that we all play a critical role in helping people achieve wellness. So I think the more you learn, the more you can do. And lives is what we're in the business of saving. So I'm happy to be here, and let's have a great conversation.
Outstanding, and thank you. For those of you who are inboxing asking, where is Dr. Pete? Well, Dr. Pete won't be with us this evening, but he will be joining us again on next Monday. So know that he is fine. He is okay. He just has those daughters he's got to get together, but he's on his way. So he will see us on next Monday. And we'll say hey to Virginia Knight that's here with us. She says good evening to everyone. For those of you who are asking where is Dr. 100? Well, Maya is on her way. She's just seen a few patients. but she's going to check in really shortly. The Vice President of Sales and Marketing at Zing Health, demonstrating a strong commitment to ensuring that beneficiaries choose the right health plan for their particular needs. Extensive experience in healthcare insurance industry, commonly referred to now, she's commonly referred to as the encyclopedia of knowledge on all things that is Medicare. Some of you may not know she's from the Motor City, Detroit, and she may actually in her spare time be a Motown buff. Who knows? That's her. That's our very own Miss Selvey. Go right ahead and introduce yourself, Miss Selvey.
Wow, thank you so much for that wonderful introduction. I appreciate it. My name is Sadia Selvey, and as Nicole stated, I am the VP of Sales and Marketing for Zing Health. I've been in the Medicare industry for the last 17 years and in the Medicare space, for 17 years, but healthcare the last 27 years. And I am just excited to work with wonderful leaders like Dr. Whitaker, who has started a Medicare Advantage plan that is definitely unique in the market. And I'm excited to just speak on that on tonight. Thank you so much.
Outstanding, outstanding. And I see Dr. 100 has joined us. Hey, Dr. 100, introduce yourself.
Hello, everybody. Hi, community. Thank you, Nikki and Congressman Davis for making this space. I'm excited to join this group of wonderful, intelligent colleagues, and let's get into the talk and let's learn from each other.
Absolutely. The founder and executive and chairperson of Zing Health, who began his career as a primary care physician, a researcher, and an advocate focused on preventive health and healthcare disparities in communities of color. Well, he has served as the executive vice president and a strategic affiliation and associate dean of community-based research at the University of Chicago Medical Centers, where he led the Urban Health Initiative, named by the Modern Healthcare in 2021 as one of the nation's top 25 innovators. Guess what, guys? This is a man of vision. One who you may not know really in his private time is an adamant reader. Let me introduce you guys to Dr. Eric Whitaker. Dr. Whitaker, why don't you give us a brief introduction?
No, thanks a lot, Nikki. It's a pleasure to be here with you and of course, Congressman Davis, who has been the people's advocate for healthcare since I've known him, since I came out of the womb. And it's, I'm an internal medicine and public health physician by training who have my practice has only been in public health settings until I became a serial entrepreneur. So Zing Health is the third of three insurance companies that I've been a part of founding since 2012, which I have to tell you is a long way away from where I thought I would be. But to be able to have a company with 80% of the workforce being Black folks that's designed to serve Black and brown folks, it's been a great honor to get that off the ground with people like Sadia Selvey, who I call the conscience of our company.
Outstanding. I want to say hey to Tamika Thomas, who is here. She says good evening to everyone. To Carrie Steele, who is here. To Audrey Jaycox, who is here. They're chiming in and sending thank yous and gracious hellos to everyone that's here. But to the man who makes this possible for us every Monday night, to the one who continues to teach us that true wealth is health, that's our very own Congressman of the Illinois 7th Congressional District, Congressman Danny K. Davis.
Well, let me just thank all of you for being a part of this Monday evening. We are back in Washington, D.C., and of course, we are excited about that because we've been away for a while. And of course, the prognosticators who suggested what was going to happen politically in this country did not happen, or it did not happen the way they suggested that it was going to, and we're still awaiting the final outcome of what may happen in the House. I want to especially welcome our guests for the evening. Detroit brings back good memories. I worked in Detroit for 2 years as a consultant to the Detroit Medical Foundation. And of course, they started a health maintenance program. And I was their HMO consultant during that period. So we've had lots of fun. Also, I've known the Whitakers for a long time, both in different ways and from different associations. Dr. Cheryl Whitaker, I first met over at Rush University Medical Center. And of course, Dr. Eric Whitaker in many different capacities. And so we are delighted. This is the enrollment period for those of us who are fortunate enough, and individuals who are fortunate enough to have health insurance and be part of a plan. So I'm excited about listening and hearing. Thank you all for being here. Dr. Whitaker, thank you very much. And I describe what you have done the way Dr. Mason describes it as incredible, unbelievable. I mean, it helps to keep hope alive, and to see African Americans bring their talents and skills together and generate the resources and the expertise needed. It warms my heart, even though it's kind of cold in DC tonight. So, Nikki, let's go ahead and take it away.
Yeah, unmute yourself.
Thank you so very much. I want to say hey to Jack Lynch, who's here with us. He says good evening to the team, to Kathy Hayes, who is here, to Mr. Freeman, who is here, to Brian Wallace, who is here with us on this evening, to Gwen Jones. She says good evening to everyone. Lorenzo Burton says good evening, everyone. Mr. Bio says, Danny, you got my vote all the time, period. Audrey Jaycock says, thank you for another health conversation and something we need to know. What is Medicare A, B, C, D, X, Y, and Z? I love it. Kathy Hayes is saying, I agree. Johnny Diggs, who is here, and Karen Yarbrough says the same. Tamika Tang, who is here with us, she says, good evening, everyone. And to Deborah Williams, who is here just as well. Well, I guess that first question is, what is Medicare parts A, B, C, D, E, F, and G? Go right ahead. Who wants to tackle that one?
I can definitely speak on that. And so Medicare is composed of original Medicare, which is Medicare Part A and Part B. Part A, think of it as hospital insurance. Part B, outpatient insurance. And it basically gives Medicare beneficiaries access to health care from a doctor-hospital perspective. And that's Part A and Part B. Part C is Medicare Advantage. And it's called Medicare Advantage for a reason, because it gives more benefits than original Medicare. And it bundles Part A and B, and most of the times Part D, which is for drugs or prescription drug coverage. And Medicare beneficiaries can also often get Medicare Part A, B, C, and D at no additional cost when it comes to monthly premiums. Of course, every Medicare beneficiary pays a Part B premium, but when they bundle those plans together with Part C and Part D, normally there's no extra costs, and Medicare beneficiaries have access to benefits not covered by Medicare.
Okay, outstanding. Did anybody want to add to that? All right, Bonnie Schmidt
Sure,
leaves here.
I'm going to
go right ahead.
No, what I want is that I've been on several shows with Ms. Selby, who I think is just amazingly a Medicare guru. And she knows that what I'm about to ask her to do, because too many people think just because they have Medicare and A, B, and it says hospital and it says medical, that covers everything, but it does not. And he reminds me all the time about a situation where he saw a man about to lose his home because he didn't understand that. And one of the things we want to do is make sure that people understand why we want to talk about Medicare Medicare Advantage, and Zing in particular. So, Ms. Selby, you know that drill.
Yeah, so Medicare Part A and B, of course, it doesn't cover everything. And traditionally, prior to Medicare Advantage plans coming into play, if Medicare beneficiaries did not receive employer plan coverage upon retirement, traditionally the second choice or option that they had was a Medicare supplement. And that's the A, B, C, D, E, F, G, H. Those are, and those plans are called Medigap plans or supplement plans because they help to cover the gaps in Medicare, but at a cost. Most individuals who opt for supplements, they're going to pay a monthly premium, and it does not include Part D, which is a prescription drug premium. And so a lot of times when I explain it to Medicare beneficiaries, in terms of their options, they're going to pay a Part B premium for their Medicare Part B. And traditionally, if they go with a supplement, that's going to add an additional premium. And also they'll be adding Part D, which is a premium. So potentially they can have 3 premiums. And remember, most Medicare beneficiaries are on a fixed income. But when they opt into Medicare Advantage, if it has a premium, it's a much lower premium, and it most oftentimes includes Part D. And one of the things that I'll say about Medicare Advantage plans that I can't even say about a Medicare supplement is that it has a maximum out-of-pocket cost, so it shields the Medicare beneficiary from absorbent Medicare costs. And that's probably one of the most important things to understand about a Medicare Advantage plan is that it does have a maximum out-of-pocket, whereas Medicare does not. So if someone has original Medicare, they're subject to absorbent out-of-pocket costs, as Dr. Mason shared an experience that I had encountered where a gentleman had a stroke and was in the hospital for over 90 days. And the hospital, to my disbelief, was putting a lien against his home because of all of the out-of-pocket expenses that he had occurred as a result of that hospitalization. And so from that point, it just made me passionate about explaining and ensuring that Medicare beneficiaries really understand the cost that they could be subject to when it comes to original Medicare.
Outstanding. Well, Antonio Brown is here with us, and he shares that he has those 3. He lists them all. He has all the alphabets, so he's aware, and he's talking about a bounce back. So I'll let one of them read over that question, and we can come back and attack it in a few moments. Sister Bonnie is here, and she says hello to everyone. Pat Ray Easley is here, and she says hi, y'all. And Judge Marianne Jackson is here with us just as well, and she's saying hello to everybody. Dr. Whitaker, there's a specific question just for you. I got an inbox question that says, Dr. Whitaker, what are your thoughts of pre-authorizations for medications, and why does it apply to those who may be on Medicare?
Well, one of the things, are you talking about prior authorization? I think we're talking about prior authorizations.
One of the things was authorization, so maybe that's what they're saying.
Yeah. Well, one of the things just in setting up Zing that, as I gathered around the table with our team, we wanted to make using Zing Health as easy as possible. So we try to put as few barriers as possible from people getting the resources that they've earned. And in fact, one of the things that Sadia said very early, when we started, was that she had been working with so many plans that have been in the industry that would show you a benefit, and when you actually went to use it, you'd find out that it really wasn't a benefit at all. So when she designed our first benefits, it was really about creating benefits that people could use. So in terms of something like prior authorization, which can be used as a barrier by some plans, we try to limit prior authorizations for physicians, which is, and in fact, I started
Did we lose them?
Find it after the service has been provided, which is pretty crazy. But so we've intentionally tried to create as few barriers as possible for our members as well as for our health providers.
Nikki, I wanted to kind of chime in and ask a question while I'm chiming in, and I'm with Advocate Aurora, so we're particularly in the South region of Chicago, not our entire system, but in the South region, we definitely have a lot of people who utilize Medicare Advantage. One of the things I like about it is it allows for us to, kind of be responsible or accountable to the care of the patients we serve, meaning that if we do a really good job doing that, the government rewards us by giving us more resources to create programs to help people. Like we have what we call an acute care center on the south side, 95th, near Western. And in that model, it allows you to, maybe provide transportation for a senior who has a lot of chronic illnesses. Maybe it helps you to have a pharmacist and a nutrition professional and therapy all in one visit in this one site. So I like that model because it does allow the health system to be rewarded by actually taking better care of people. And I just want my guests to comment on, the difference between the old HMO model where people sometimes felt the care was being restricted and, I'm not going to get my referral for my MRI because they didn't want us to get it, where it seems with Medicare Advantage is a little bit more of let's keep people from getting too sick. So we're going to allow them, as Dr. Eric has suggested, to get the test so that they can actually stay healthy, which will reduce the overall cost of care. So just comment a little bit about the difference between that old model versus this new model.
Yeah, Sadir, were you going to go ahead, Sadir?
No, I was just going to say I definitely relate to that because when you hear HMO, of course there's a stigma associated with the old model, but with the Medicare Advantage plan, and this is the great thing about Medicare Advantage plans are required to cover what Medicare covers. And so people are not going to lose out or lose their Medicare because they opt into a plan. They're actually going to receive more benefits. And the great thing about it is that a lot of times Medicare Advantage plans are ensuring access, because what Medicare did is Medicare is a payer system. And what Medicare does is it pays claims, but it doesn't enforce some of the regulations and rules around things like a prior authorization or referral. And so Medicare hires private insurance to kind of enforce the regulations of Medicare to, of course, decrease fraud, of course, but also to increase utilization from a standpoint where it's managed and to ensure that people are actually getting access to the care that they need. And I think some of those barriers are coming down when it comes to Medicare Advantage. Medicare predicts even by 2029 that 49% of Medicare beneficiaries will have a Medicare Advantage plan. And so it does create some opportunities for access to benefits that Medicare beneficiaries wouldn't necessarily have access to, like some of the things that Dr. Tony mentioned, like transportation, grocery benefits, benefits for making the home environment safe. There are so many additional benefits that Medicare beneficiaries now have access to that they don't traditionally have access to. And even from a STAR standpoint, as Dr. Tony mentioned, there are some incentives that are given by Medicare to ensure that Medicare beneficiaries receive this quality care and quality access. Unlike, traditional HMOs, where it's more so geared toward kind of steering patients into managed care where they don't necessarily have a voice. I think it's the opposite, Tony.
I just want to say, listen, if you have this type of plan and you get a call from the doctor's office about doing your wellness visit, don't be surprised. Mm-hmm. Don't be surprised if you get a call about, getting your hemoglobin A1C if you're diabetic. Don't be surprised if somebody's calling you saying you need to come in for your mammogram. Don't be surprised if you got to do that test. You hate doing that stool test to make sure you don't have colon cancer. And what I love about this model is it forces everybody on the team to be engaged to get you in to improve your care. And that's why we have been talking about Medicare for all, because the Medicare model is a model that, protects the health professionals and the people you provide care to by giving them sufficient resources to provide that care. So I really love that model. And I just want to say it's a partnership. So everything that we're trying to do in healthcare is to work collaboratively to keep you healthy. So that's why I'm a huge fan of this model.
Yeah, I was just going to add that, one of the reasons that as I thought about starting something like Zing Health, which is unique in that it's doctor founded, when we see our members as our customer, but we also see Dr. Tony and other doctors as our members too. So when I talk about removing barriers, it's really about trying to get care to the appropriate place. And when I started this journey, I started working on this in 2017. And at that time, Medicare beneficiaries, only 19% of African Americans were taking advantage of Medicare Advantage. And that means that all the wraparound services that we're talking about were not being utilized by our folks. We were staying in original Medicare, which again is really just a payment mechanism. It doesn't take a holistic approach to the patient to make sure that they get a lot of the other things that are needed to keep one healthy. So excited that you see the world as we do, Dr. Tony.
Okay, well, Chief Vitale says, I'm glad to hear about the preventive model. He says he is glad to hear about it. Edna Weatherspoon is here and she says, good evening to all. She's saying good evening. She wants everybody to know that she is here and we thank you. Want to say hey to Regina and Smitty Smith who are here along with us, just as well to Dolores Wiles who's here. And she's saying thank you for the conversation. To Tamika Thomas says, hey, Uncle Terry. And I think Dr. Mason has dropped off just a little bit. And I think it was probably because he was transitioning to his laptop. And there he is. Doretha Johnson is here. And she says, I am loving this information. Bertram Cranfield is here. Alex Rosenthal is here. Dottie Walton is here. And they're saying, thank you for explaining the alphabet soup of Medicare to us. I have a question from a young man who wants to stay anonymous. And he says that my mother suffers from severe dementia. Is palliative care a part of these alphabets? Well, don't all of you jump at that question at the same time.
Well, let me just comment. If you have any chronic medical condition that's very challenging, you should be signing up for palliative care. And I'm saying that because a lot of people misunderstand the difference between palliative care and hospice. And the way I try to frame it with patients is that hospice is comfort care and palliative care is supportive care. So even if you have something like COPD, congestive heart failure, you have a horribly disruptive back that's, just making your life difficult. Palliative care, you have clinicians and a team of people who are experts at pain. If you're having troubles breathing, they're experts at helping you be more comfortable with your breathing. So as a general theme, if you're struggling with a chronic illness, and dementia would be under that category, palliative care would be important. But most importantly, it allows you to have goals of care discussed. And I'll be honest, there are a lot of clinicians who don't talk about goals of care. They just talk about treatment. But sometimes the treatment that's being recommended is not appropriate for the patient's goals. So sometimes you just have to pause for just a second and say, you have cancer. What goals do you have for the next 6 to 12 months? And maybe the oncologist is only focused on the treatment, but guess what? If your goals are not aligned with the treatment, you shouldn't be getting chemo. So it's just a simple conversation that I think that we should have. And in general, if I had any chronic disease, I would at least have a consultation with a palliative care clinician so that you can at least see, because again, it's about, what we talked about so far is resources, right? when you become a patient under palliative care, you have additional resources. But most importantly, you give your family a break, because now you have somebody that's going to support you and your family and the clinician who may not have had that conversation you need to have.
You know, I would also add to that, before you get to the need for palliative care, there are a number of things that can be done. And in the plan that Dr. Whitaker has outlined, I just want to say that I've talked with Dr. Whitaker many times. And really, when you have a person who comes out of the background of serving our community as the state health director, and in the many other capacities that he's served, and get a chance to be involved in managed care in other ways, you understand that our people have some significant problems that need to be addressed in a different sort of way, in a more comprehensive sort of way. So even beyond the point you get to the point where you need palliative care, you're that sick, what happens in this plan is that there's a person that actually calls you, that checks on you to make sure you're okay, that makes sure you don't want to go get groceries for you, or you may need help for, and that the plan that he has put together does those things. And this is so important. And I've had the opportunity to interview Dr. Whitaker and many other members of the team on my radio show for an hour at a time. And I've learned so much about what Zing does and how it's different from some of the other plans. And that's because when Dr. Whitaker was running Project Brotherhood out in Woodlawn, when we were dealing with Black men, it takes somebody who understands our community to start talking about how these plans should be formed. And that's, I think, the real advantage to what he's done is that, and if you look at his administrative team, if you look at the top management in that team, it reflects the people, not that we're not talking about whites or anybody else, but we have really, and we think that, maybe Black folks would just be for Black folks. No, we have talented people, both Black and white, that do an amazing job in carrying out these things. But it takes vision at the top, which is what I'm so proud. And I got to say this because I've known Dr. Whitaker for a long time, a very long time, back to my time as a resident at Michael Reese in urology many years ago. So I'm passionate about what he's done, and I'm passionate about trying to get him to get into the spaces that he needs to be in so that people know what they get. And he has people who coordinate not only just their prescription medications, but if you're taking over-the-counter medications and prescription medications, they look at those too to make sure that there's no clashes. So I'm going to stop right there because I could go on and on. But these are all of the things that, to what Dr. Tony was saying, these are the things that are important, because if we overlook the small things, we'll never see the big ones.
Outstanding. Our group, did you have something you wanted to say, Sadia?
If I could just quickly add to that. And one of the things I get really excited about when I came to Zing Health, and when the initial time that I talked to Dr. Whitaker, like I said, I had been in the Medicare Advantage space for 17 years, and coming to Zing Health was so refreshing in that for the first time, I've worked for national carriers. I heard the CEO talking about the members, talking about the providers, talking about how to solve for some of the access issues that members have with Medicare Advantage plan. And that really piqued my interest because I had left the company because, for lack of better words, if I say that you have the benefit, you should be able to access the benefit. And that necessarily wasn't happening. And one of the things that with Zing Health that I'm just flat out adorned by is the fact that we align what we say with access, with care, and also access, not just access to care, but access to quality care. And then it aligns cost as well. And one of the things that we do, because we do have unique situations that plague our communities, and we know that social determinants of health account for 80% of health outcomes. And those things have nothing to do with medical, but they impact medical from that perspective. And so when we look at things like insulin, it plagues our community from a cost perspective where people cannot afford insulin. So if I can't afford insulin, that means I can't manage my diabetes. And Zing made a conscious decision this year to put all of our insulins at zero cost share, not just during the initial coverage phase, but even during the coverage gap. Because a lot of times when people are on insulin, it's such an expensive medication that they meet the coverage gap by May or June of that year. And what I mean by coverage gap, it's referred to as the donut hole, where they have to pay the majority of the cost for that medication. And if they cannot afford it, that will impact their ability to manage diabetes. And on top of that, we also looked at the diabetics on our plan. We let them know that the cost of insulin would be zero during the initial and coverage gap phase. And we also are educating our patients or our members about continuous glucose monitoring technology, which is very expensive. But with Zing Health, it's covered at 100% because the goal is to get those members to manage their diabetes and to give them not only the tools, but also align the costs so that they're able to manage. And so that's what makes me really excited about Zing, is that those social determinants of health are what we focus on, because we understand that's going to help improve health outcomes. Not just saying a person has access to a benefit, but ensuring that they're able to not only access it, but it's affordable so that they can manage those chronic illnesses.
Well, I've gotten a whole bunch of clapped hands and thumbs up behind that statement, because one of our questions was about that donut hole, and I really think you cleared it up. So thank you so very much. Our group that kind of watches all together, but they are working over at the Core Center. I have to say that they are working, but they are watching. They want to thank the congressman for this episode. And they say, we thank you so much. We run into this so much here, and we have to share it. They're calling their social workers to have them chime in. Also, some of our advocates over at the VA hospital said, say my name, Jesse Brown. Okay, we got you. We've said it. And Hines is in a little competition too, because they say, Nikki, we are here and was here 2 weeks ago and you didn't say our name. So hey, to Hines VA Hospital just as well. And they're all thanking the congressman for this space and how we are educating the community. We have another anonymous that says, I work for the state, and when I turned 65, they ended my insurance and converted me to a Medicare Advantage plan. Is this the same?
Well, we don't actually have a contract with the state, so it's probably Aetna. I think Aetna offers health insurance for state employees once they retire.
Okay.
Yeah.
All right. Thank you so much.
Nikki,
go ahead.
How do we, I just want to provide clarity, because that kind of, like, I think we need clarity about how do people get access to your plan? Is it through a direct connection, or is it through, like, provide clarity about that?
Yeah. Well, you know, I even am afraid to speak with Sadia being on the same line, because she'll correct me very shortly. But you know, there's a federal website where folks can go and compare plans, and you may decide to pick one plan over another depending on your medication profile or different benefits that are there. That's one avenue. Another avenue is you know, you can go directly to our website and you know, which is what is it?
So, how they get access? We have licensed Medicare advisors who are able to come out to their home and walk them through the benefits that they, you know, may need. They can call 1-844-937-9464 or www.yeszing.com. So either way, and now it's open enrollment from October 15th to December 7th. And so this would be a good time to evaluate whether or not you have the benefits that you need for the upcoming year. because this is the time to make those important decisions.
And I just want to encourage people to really talk to someone like our benefit consultants. And as Terry knows, if I don't believe that if you talk to our folks, if our product is not good for you, you should go somewhere else, and we'll direct you somewhere else, because we really want people who fit our plan to be on our plan. And if you really should be somewhere else, we should help you figure that out. There's a dizzying array of options that are out there, and taking the time to walk through your particular situation and figuring out what's important is key. And every year there's new products that come out. Like, you probably have seen one that talks about getting more money back into your Social Security check. And that's been publicized a lot. I actually wouldn't advocate that one for you because you will get money back in your savings account, but that means that you have to give up a whole lot of other benefits that would be important for you to get that money, and the value is not one for one. You're giving up a lot of benefit to get the cash back into your Social Security check, and then when you need it, you'll find out your plan doesn't cover something that you might need. But you need to have that conversation. But there's a lot of people pushing that, and people are picking that. So we have one of those plans. But if you talk to our people, that's not one that we would, after we do a needs assessment, would necessarily push people to get into. So you should have that conversation and figure out what's best for your situation to make sure you get what you need to keep you healthy.
Now there is and I dropped off, my internet cut off for a second, so I apologize if I missed it. I know we were talking about how people can get access, and it sounded like we offered websites. Is there a phone number for people that are experiencing like maybe the website isn't an option? Is there a phone number where they can talk to like a benefits navigator or something like that?
Yes, that number is 1-844-937-9464.
And we have put it in the chat because Stephen from your office, Dr. Whitaker, has actually sent it to me, and I actually put up exactly what he said. He said, "Hey, Nikki, please announce to the listeners that if they want to learn more, they can dial this number and go to this website." So we actually put the number up in the chat, and we did it just as he sent it over. Now, Tina Hammond is here, and she says hello. Oh, go right ahead. Go right ahead, Dr. Whitaker.
I was going to say Nikki Stevens sent it to me also. so he's thorough like that to make sure that I was.
He has probably texted the congressman by now too. He wanted to make sure we are.
So I do.
I just want to add to this that is a very important call. Very important call. And don't expect it to be 2 minutes, because you're worth a lot more than that. And you need more time than that in order for someone to go through all of the things that are particular to your circumstance. Because to have somebody, I remember when I retired and I was going through this whole Medicare maze myself, and it was a mess. And it was, and I'm reasonably computer literate, but to have to go through this website and get this and website to do that, and make sure I had all the, the Medicare A, understood B, and all the other stuff. And then before they had Medicare Advantage, all those other things, the different add-ons that you could get, supplemental things, and all come with a cost. So what I would just say very quickly is make that call. Take that and be patient, sit down, put some time aside to get the information you need. And you want to make sure that you have the information that you have in terms of your current insurance plan. They need to know that, and something about you. They'll ask all of those questions. These are people who are trained professionals who can ask the questions that need to be asked for you. But I just want you to know this is not something they take lightly. So you want to make sure that you allocate the appropriate amount of time so that you can get your questions answered.
Outstanding. Well, Dr. Maya, I know you've been yearning to say something. Go right ahead.
Also, I was gonna ask Dr. Mason kind of hit on it. What are the things, if I'm a person listening, what do I need to bring, or what should I have to prepare for this conversation that Dr. Mason mentioned? Do I need a list of my diagnoses? Do I need, like, what do I need to bring to that call?
And so when you sit down with a licensed Medicare professional, you would definitely need your Medicare card, any insurance card that you currently have so that they can understand what coverage you currently have, a list of medications that you're currently on. And also, we don't necessarily, Medicare beneficiaries do not have to disclose any medical illnesses or diagnoses unless it's for the purpose of enrollment into a plan such as a chronic special needs plan, where that eligibility is determined by a chronic condition. But outside of that, they do not have to disclose any diagnoses or anything like that, because Medicare Advantage plans do not have pre-existing clauses or anything like that, so that they don't have to disclose any
Okay,
illnesses.
and then my last, oh, I'm sorry, were you finished? I'm sorry.
Yes.
Okay, thank you. And I have one more question for you. Thank you for and as I prepare for this, something that a lot of people that are related to me experience every time this period comes is we got some dates, right? And a lot of times I have friends, family maybe, that wait till the last, and then they get caught in this like ever never ending, the phones get, the internet gets overwhelmed, the phone lines get overwhelmed. What advice would you give? I mean, I always try to say, hey, it's open now. Call, don't wait till the last minute, because
Right.
then you're in with a group of people that are all trying to get those same things, and then and you don't have time to have this conversation that Dr. Mason is talking about.
Right.
What would you advise?
You gave them the best advice. Don't wait until the last minute. Because if what's important to them, they may have to take a look at a couple of plans to understand and ensure that, the coverage that they opt into is the coverage that'll suffice for the following year, because most oftentimes they're locked into the plans that they choose. And then you have the Medicare Advantage open enrollment period from January 1st to March 31st. And that's specific to anyone who has chosen a Medicare Advantage plan that maybe didn't opt into a plan right now because maybe they waited too late. They'll have another opportunity to, look at another plan during that Medicare Advantage open enrollment period. But that's probably the best advice, is not to wait until the last minute, because they want someone who will walk them through a thorough needs analysis to ensure that they have the benefits that they need.
Okay.
And that their providers are covered. And Tony, I just want to say this really quick. I commend Advocate. They've done an outstanding job with understanding how Medicare Advantage plans work. And they've worked with Medicare Advantage plans for a number of years successfully.
What happens if somebody loves Dr. Maya, loves Dr. Miller, loves Dr. Mason, and they're like, I ain't going with your plan unless I can see Dr. Mason? So how does that work in terms of being able to get to certain providers or health systems?
So one of the plans that we have is called Zing Open Access Plan. And the Zing Open Access plans allow Medicare beneficiaries to go out of network to see certain specialists or go to hospitals that may not be in the network. Now, one of the things that we did, because remember, Zing is unique to making sure that our members have access. And so most Medicare Advantage plans who offer point of service options, a lot of times members cannot access those out-of-network benefits because they have a 40 and 50% coinsurance associated with them. So it's almost like penalizing them for keeping the doctors that they want to see. So one of the things that we did is we removed that penalty, whereas our members can go to out-of-network providers at the same cost share that they would see in-network providers. And we created an ID card specific to those out-of-network providers to say, hey, this is instructions on how to take this patient because we want that patient to continue to get access to the doctors that are important to them. And so it lets the doctor know that they'll be paid Medicare fee for service. So there's no reason to reject this member at the point of service. So we educate that provider, we educate the member, give them a secondary ID card to ensure that they're not turned away by a doctor that they intend to keep.
All right, outstanding. You know, I love it when we have our viewers start chiming in, telling other people to come on and view, and then the other people answer them back and says, I'm listening, I'm here. I love it. I love it. So thank you guys so very much. You know, Chief Tally says, yes, this is a special need, that it is so needed. And he's saying, thank you. You know, Dr. Miller, right before I go to this next question, because we got 3 questions left that we're going to take really quickly. You look like you had something to say and you were trying to get in, but some stuff was going on.
Yeah. Well, I guess I had one thing was a question, and of the Zing plan. Is the Zing plan different than, say, Humana? Is it more like Oak Street, or is?
No, I mean, go ahead.
No, go ahead, Dr. Whitaker.
No, Sadia, you're the explainer in chief. Go ahead.
So Oak Street is just a provider under network with the Medicare Advantage plan. So Humana may have Oak Street, United Healthcare may have Oak Street, Zing may have Oak Street, but they're a part of the network. Okay. So no, they're not the same as a Medicare Advantage plan. They're just an in-network provider.
Okay, all right. Now, the other thing that I was going to say is that and we've talked so often on this show about people having total health care, and that means that what we meant by that is that people need to be the cost of health care oftentimes is predicated on people getting the care they need when they need it, as opposed to someone don't get the care either because they can't afford it or because they're denied that care. And when that becomes the situation, that in itself is going to, on the individual, going to lower their costs, but also on the system. It also lower the cost when people can receive care timely and appropriately. And that's such an important thing. During my years of practicing, oftentimes, and it was a little bit when we were get to this stage. We weren't at that stage back then. Oftentimes the patient got an insurance and they didn't know what they had, and they didn't really look at what their needs was, as opposed to, I just need insurance. And so so I'm so happy to hear that there's someone also explaining, and not only just explaining, but listening to what the needs of the individual members are, so that they can address those needs and make certain that these individuals have what they're going to need in order to be able to get the best possible care that they can get.
Absolutely. And that's critical, as you just stated, Dr. Miller, is that we listen. And that's one of the things that we take pride in, is listening to our members. During the pandemic, of course, there were several issues that arise, but one of the things with our members calling who were a little depressed because they weren't able to see family members. We saw the food deserts, we saw the food lines. We sat down at a table during the pandemic and said, we need to create benefits to combat these things that we're seeing. So we instituted a grocery benefit on our plan, which gives members access to up to $50 every month for groceries, to ensure that they have groceries, as long as we can tie it to a chronic condition. And this is what we did. Medicare said, if you're going to offer a grocery benefit, here's 15 categories of chronic conditions. Choose a couple of conditions. We chose all of them to ensure that our members we could maximize the number of members that would qualify for this benefit. Another thing we did is we made behavioral health care at no cost for members during the pandemic. And even now, they have access to behavioral health care in the event that they have those isolation or depression issues that surfaced during the pandemic. And so we're very conscious, socially conscious. We're conscious of our members. We're member-centric, provider-centric, and we also listen to our agents, and we take those things into account. And that's the one thing that I can say that makes us different and unique in the market. We listen, and not only do we listen, but we implement the things that we hear.
Yeah. To put a finer focus, the fact that we're doctor focused, doctor founded, is not a small thing. You know, we paid 95% of our bills within 15 days. So you can imagine, a lot of insurance companies play funny with the money, and particularly our providers can't survive. They need to get paid on time. And so we push that money out because we know it's critically important to maintain access for our members, but also to support the physicians that work with us.
Outstanding. Well, Pat Ray Easley asked a question, and her question is, what is the physical and psychological limits between child discipline and child abuse? And how are we advocating one over the other? But right before we look at her question, and I know some of you doctors are kind of thinking about it, right before we look at her question, I have a question that's back to this subject. And they ask, I love the Medicare. I love the explanation of everything. My mom is sitting here really enjoying this. She says now all the commercials make sense. And this has given her some real choices to make. She thanks the congressman for this forum. I'm not of Medicare age as of yet, and I have questions about what should I choose? Any suggestions? Do you offer things for people who are not of Medicare age as of yet?
If that question was for Zing, my apologies. It's specific to Medicare beneficiaries, but that does not mean that they're 65 and over. So with Medicare Advantage, if you qualify for Medicare, that could be people 65 and over, people under 65 who qualify for certain Social Security disability, as well as people with end-stage renal disease of all ages, and people with Lou Gehrig's disease. Those are all individuals who qualify for Medicare. And so our company is Medicare focused, however.
But Nikki, the questioner, brings up a great point, which is we all need help in understanding the complexity of the insurance. And I laughed when Terry talked about when he turned. I think you were turning 70 when you were kind of enrolled, Terry. But I remember Terry was trying to figure out what was going on. He's like, I'm a doctor and I don't understand all of this stuff. So we need explanations, for the Medicare age, for every other age, because insurance is so needlessly complicated, in my view.
Dr. Whitaker, to your point, when you had to deal with Medicare Part A, B, C, D, there's a whole alphabet full of before Medicare Advantage came to the front, because you needed all these things to cover all these different parts. But the good thing about Medicare Advantage is that they put all of that together with a $0 premium, and you get the benefits that you need. And I would advise anyone, don't take our word for it. Call a number that you were given. And I'm sure Sadia give the number out again, but call that. You really do need to sit down and take the time and talk with somebody, because your situation is your situation and may be different from my situation. So you need the solution for you.
Well, there's one commercial that I really love, and that's the two ladies sitting in the kitchen. Because for those of you who know us, that's where all of our conversations really happen, the kitchen conversations. So next Saturday, ladies, when you're having your brunch in your kitchen with all your girlfriends, dial the number. You all stand around the speakerphone, go one by one and get all your questions answered. But remember to have a pen and pad. Most important thing to have. Remember, I tell you guys, I'm always the doctor's worst nightmare, because I go to the doctor with my iPhone, and in my notes, I have all my issues that I want to talk about really quickly. Here's your chance to get all your questions answered. Sadia, you had a wonderful answer, and that takes us back to Mr. Brown. But you know what? Hold on. Pat says, don't forget her question. Okay. Can somebody answer Pat's question for me, please? I think I read it. She was asking the question about, physical and psychological limits between child discipline and child abuse. How are we advocating over one over the other?
I'll make it personal. So I'm sitting, next to my father-in-law, right? He's been quietly, patiently sitting next to me. And ironically, my wife just yesterday said that in her entire lifetime, she's only had physical discipline one time. Now, of course, she was a good kid. And guess what? I have the same resume. I've only had physical discipline one time. I can't tell you what I did, but it wasn't right. So, but my point of it is that we both turned out okay. And I remember the day when my kids were, when I told my parents that we're not, I watched Oprah one day and this Black psychologist said physical discipline is not appropriate. And she gave a very, reasonable explanation. I don't judge anybody. I just found it for me, discipline was just about you have consequences for your behavior. So if my kids if I tell them do not, play video games before homework, if I come home and they're playing video games and they haven't done homework, I don't yell and scream. I just said, okay, well, I just walk over to the video game and I remove it. And then I just put it away for a couple of months. It's very simple. So to me, discipline is teaching our young people how to understand consequences for their behavior and just building that, because they have to have that in society, particularly in communities of color. But if you physically abuse somebody, you are not just traumatizing them for the short term, but you traumatize them emotionally. They may have, if they have an upset stomach problem or headache problems, it may be because of that abuse. They may have fatigue problems because of that abuse. So I just think that in general, there's ways to create the kind of human beings we like without being overly physical. I found that it was not necessary. My kids went to a top 20 school. They're doing just fine. They did not get physical discipline. And I think it's just cultural. And I think that it's okay to learn a different way. And that's what I had to do. I had to hear a different vision. I learned a different way, but I grew up in an environment where physical discipline was expected, but I just found that it was not very effective. So that's just kind of a personal testimony and how I want to answer that question.
Yeah, I think one thing is that when we say discipline, we have to be careful and really understand what we're talking about. Discipline is a necessary part of functioning. Discipline is about controlling, and we discipline ourselves, and that's an important thing. In order for us to live with other people, there has to be some kind of cooperation. So that means that we have to have some discipline within our lives, within our behavior. Now, physical discipline is a totally a different story. However, abuse can be one can be a child, or anybody can be abused without and somebody else attempt to discipline them without you even touching that person. So emotionally and psychologically, you can abuse a person. So any kind of we want to, what I always try to do with my children is that I try to explain to them why I was objecting to maybe a particular action or activity that they were doing, and why it was my thought process was as it is, but explaining to them also that in life we can't just do everything that we want to do without regard for other things and other people, even ourselves. I mean, one can abuse their own body. As we often see with in our practices that people are so abuse and discipline to some extent can be on the same level, but on the same floor, but at a different level of what it is that you're doing and how it is that you're doing. Hopefully that when we teach discipline, we're doing it through love, and that we are doing it in a way that is going to be less traumatic to the person that we're disciplining as much as possible. But I mean, that is a necessary thing in our society, to have some discipline. You just can't run a society. We just can't live together without some form of discipline on our part and on how we cooperate or don't cooperate with other people.
Outstanding. Well, Pat, I know you have been trying to get your question in for a while now. So we made sure that we did ask that question for you. And we thank you so very much for sending your question. Mr. Brown says, OMG, what a wonderful conversation. Can you believe that I am 40 years old with Medicare? Yes, I have Medicare Parts A, B, C, and D at the age of 33. I've had 3 insurances, and he talks about the 3 insurances he has from Medicare to Medicaid, A and B to his Advantage plan. But he's also said sometimes I have tried to use my DC Medicaid to get my second opinion, but I get bounced back to the Medicare Advantage plan, which is my primary insurance. I would like for the congressman, maybe I think he really wants Sadia to explain this. So, Sadia, can you explain why he's getting the bounce back?
Absolutely. Something occurs when someone is on Medicaid, full Medicaid, and they become eligible for Medicare. Think of it as Medicare taking over. Medicare becomes the primary insurer. Medicaid no longer really acts as the insurer, but it helps with the out-of-pocket costs. So all of those medical benefits, for the most part, are going to come through Medicare. And that's why when he tries to access his benefits, they push it back to Medicare, because Medicaid becomes where it just really helps with the out-of-pocket costs for like his premiums, his Part B deductibles, his Part D co-insurances. It's going to help with the out-of-pocket costs with Medicare, as opposed to providing medical insurance for his benefits. Medicare is the insurer of his benefits. Medicaid becomes secondary, and Medicaid still provides minimal benefits, but it does not cover the bulk of his medical insurance. That's going to be covered by Medicare. So Medicare becomes the primary payer. Okay. And Medicaid is like a secondary payer for co-pays, co-insurances, and deductibles and premiums and things like that.
Or the other way that Medicaid gets talked about is the payer of last resort. Because Medicaid is not they're like, oh no, you're Medicare. we come after Medicare is how it functionally operates.
So are all Medicare Advantage plans state by state, or is it universal?
It's by service area, so that it typically goes by county. And so in order to be eligible for Medicare, Advantage, you have to have both Medicare A and B and live in the service area that Medicare Advantage plan is offered in.
Yeah, so Zhang is currently in 3 states, and is it 17 or 21 counties? I can't remember if it's for next year 21 counties. How many counties are we in now? So
we're actually in 27. I'm sorry.
Okay.
I just want to also add, when I was going through this, as Dr. Whitaker.
17. I'm sorry, Dr. Whitaker. You're right. 17 counties. I'm thinking about our plans. We have 22 plans for next year. I'm sorry, Dr. Mason.
No problem. No, I think people need to understand that you get Medicare Part A as a freebie, but you have to pay for Part B. And you will learn that when you go to apply. And there are penalties that are applied if you don't do it in a timely manner. So make sure that you have your conversation. If you're retirement age, depending on where you work or what have you, you need to have your conversations with the people of Social Security. If you're adept enough to go to your computer, you can apply for some of this online. But if you don't, you can still make an in-person phone conversation, or you can call for an in-person meeting at your Social Security office. But if you're 60, you're 65, you need to make sure that you call and find out. If you don't have Medicare Part B, you need to make sure you find out why and do what you need to do, because it really can be work. So you want to get on it right away. And Ms. Selvey, I don't know if you want to add anything to.
Yeah, you make a great point, Dr. Mason. Some people choose not to enroll in Part B because of the monthly premium, and they feel that they're on a fixed income. I would say there are programs out there to assist, such as the Medicare Savings Program, that could potentially assist you with your Part B premium. And let's say, for instance, if you're a veteran, for instance, and you opted out of Part B because you have VA benefits, Medicare gives you a general election period from January 1st to March 31st, whereby if you did not enroll in Medicare Part A and or B at the time that you were eligible to, you can enroll every year during the general enrollment period for Medicare. That's for Medicare strictly, from January 1st to March 31st. And again, you will be penalized if, let's say for Part B, if you fail to enroll in Part B when you were actually eligible to, if you go 12 months straight without Part B, then you are penalized and you receive a 10% penalty for every full 12-month period that you allow to go by. So that 10% is tacked on now to a premium if you need it in the future. And I'll give a quick example. I had a gentleman who was a veteran and he did not opt into Part B because he had VA benefits at that time. And some of his VA benefits, some of his benefits went away and he then needed his Part B. Well, when we contacted Medicare to find out, what the premium would be, because it had been 8 years, he had an 80% penalty tacked on to his Part B premium. So if he thought he couldn't afford it then, he really couldn't afford it at that point. So I always educate, everyone about, enrolling into Part B. And if they feel like they can't based on income, let's talk about the resources and the programs that are out there to assist with Part B in the event that, your income goes under a certain limit.
Outstanding, simply outstanding. To Judge Patrice Ball Reed, who saw my dog jump in the picture, Silver is trying to get all the information that she can as an older pit bull, because she wants to make sure that she calls the phone number to get her benefits correct. All right. With that being said, I know you guys hate to hear me say this. I know you hate it, but we're at our time. So I am so sorry. So you know what? I got to take this next question. I have to. Last question of the evening. And it's because she's an adamant listener and she never really asked a question, but she says, is Medicare ever going to catch up with Medicaid? As far as a benefit, we have to pay into their insurance, which they get better care than us and have to pay out of pocket. So I don't know if you guys understand this question or what she's exactly trying to say.
Is Medicare going to ever get to a point where it doesn't require a copay? Is that?
That may be what she's asking. That may be it. Well, what's your thoughts on that? Are they going to ever get to that point where there's not a copay?
I don't believe so. Most insurance companies, you have out-of-pocket that's associated with every service that you receive. And again, the great thing about Medicare Advantage is that your out-of-pocket costs are limited. And the maximum out-of-pocket cost for 2023 is it was $6,700 this year, but the Medicare Advantage plans can actually go lower than that. And so let's say under Zing Health, if your maximum out-of-pocket cost is $3,900, if you hit that maximum out-of-pocket, your services are covered at 100% for Medicare Part A, services that would be covered under Medicare Part A and Part B, which includes hospital, outpatient services at the hospital, specialist visits. All of those types of services that Medicare would normally cover would be covered at 100% at the time that you hit your maximum out of pocket. So that's as close as we are right now in terms of, how it compares to Medicaid. But if someone has both Medicare and Medicaid, typically their costs are zero for their Medicare covered services.
And one thing I will say, Nikki, is that Zing is, Illinois, of course, is a special child in the country. And we have a special program with the feds called the Medicare-Medicaid Alignment Initiative. And Zing is not currently a part of that. And this is for people who have both Medicaid and Medicare. So the state has just come out with an application process that would have us in line with being able to be in the program for January 2014. And so we're working hard to make that a reality, because right now, we don't have a product in this market that has both the Medicaid and Medicare in it. Whereas in Indiana and Michigan, we do have products like that.
Do you mean January of 2023?
2024.
Oh.
Yeah. Okay. 22. It takes almost 2 years to to go through the whole process and be able to start offering the insurance January 1st, 2024.
Okay.
And Nikki, I would admonish your listeners. No, I was just going to say, I would admonish your listeners to give us a call and actually request that someone come out and speak to you, sit down with you, and then go through your benefits and do a thorough needs analysis. And again, that number is 1-844-937-9464, where you can actually have a licensed Medicare advisor come out and actually sit down, do a thorough needs analysis, and go over your plan options with you.
So to all of our pastors who are on the line, who's chiming in, who's only 24, like Pastor Spiller, who's saying that this is awesome information. If you guys want somebody to come by and kind of share that information on one night, please make sure that you do. Want to say hey to Pastor James Brooks, the president of Lawndale Christian Health Center, who's here with us just as well. He's here and he's saying awesome information. He also says, any advice for new healthcare administrators? Nikki, I would love to meet up. Well, she put her number out here, and we're going to make sure that you two connect because he wants some information from you. So thank you so very much. As I said, you guys hate to hear me say this, but we've reached our time. And I know you guys hate to hear me say it. And for everyone who has sent other questions, and even to the young lady who wrote the question, if we didn't quite answer it, just reframe that question back to me. I promise you we'll get your answer for next Monday, or either we'll put it right under your comment to make sure that we have outlined everything that you were asking. But we've reached our time. Want to make a couple announcements, make sure that you remember some things, and then we're going to do our Until Next Mondays. If you haven't gotten your new COVID vaccine, guess what? Be trendy, get it. It's like the best new pair of shoes, that beautiful coat that you wanted, that outstanding scarf. It's getting cold out, so we want to make sure that you get your new trendy new COVID vaccine. Don't forget your flu shots and shingle vaccines or whatever it is that you need to update. Let's update it. Let's be on the trend and let's update everything that's necessary to be updated. Dr. Mason, you're Until Next Monday.
Well, I want to thank you. Thank the congressman for this forum for tonight to explain these things for folks. Folks really need this. But beyond that, I want to thank the congressman because he's been an avid supporter of the different additions to Medicare and health plans in general. So thank you, Congressman, for that. And I want to thank Dr. Whitaker for the work, the tremendous work that he has done and the team that he's pulled together at Zing. And for those who've been listening to my radio show, I've had a number of folks on, and I have them on because I think you need to know the people who own the companies and the way they think, because that's going to be reflected in how that culture of that company develops and how you're going to be treated. And Dr. Whitaker has been in the trenches. I can't say this about any of the other folks, and I'm not saying they're not good or anything like that, but I am saying that you got a person here who's at the head of the table, who is directing what happens, and that makes all the difference in the world.
Outstanding. Dr. James Miller, you're Until Next Monday.
I want to again thank Nikki and the congressman for again having us together and discuss issues that are important. And this is a typical example of an important issue during this enrollment period for Medicare. It is so important that people get the right information so that they can get the right things that they need when they need them. Because what tend to happen is that when people don't get the right information, they make the wrong decision, and then they become frustrated with trying to get what they need when they need it because they haven't really prepared. So, and these are not insurances, you know, when I was a practicing physician, and now, you know, as a layperson seeking healthcare, insurance is very complicated, and it's you know, you don't. It's difficult to know those little fine line things that are not out there. But learn as much as you can before you sign on the dotted line, because once you make that decision, that is your decision to live with. So get as much information as you can before that December 7th deadline.
Outstanding, outstanding. Well, Dr. Maya Green had to pop off. She's still seeing patients really late, but she texts us her Until Next Monday. She says, excited about this conversation. The congressman is always on target. Had to go, but as I discussed previously in a conversation, it's important to support our communities through equity. This is one of the ways that we can do it. I look forward to this, and I'll see you guys next Monday. So thank you so very much, Dr. Maya. Dr. Douglas Graham, you're until next Monday.
Well, I just wanted to build on what Dr. Mason and Dr. Miller said. You know, my experience on this path was it is complicated, it is confusing, it does help to prepare. So before you turn 65 or 67 and a half, you want to begin to acquire the information. In the Sunday papers this time of year, they have columns on this. There are things on newsstand publications you can begin to read. So when you discuss with that counselor, you've got a fund of information and background to have those dialogues and discussions. So I'd begin to prepare early. That would be my next week.
Outstanding. Sadia, you're until next Monday. What do you want to leave the viewers with until next Monday?
I would just like to add, thank you, thank you to all of the doctors, Congressman Danny Davis. I really appreciate you because he's been a forward thinker for many years. I've worked with him many years with some of the community initiatives that he's done around healthcare. And I would just like to add that education fosters right choices. And so when you think of Zing Health, think of someone coming alongside of you to help you, to educate you so that you do make informed decisions. And Zing is all about doing the right thing at the right time for the right reason. So you won't go wrong in contacting us at 1-844-937-9464 to assist you in making the health decision that is right for you.
Outstanding. Joseph Harrington, you're until next Monday.
A couple of things. You can't call Congressman Davis a doctor because he has an earned PhD, so he is a doctor of sorts. The other thing that occurs to me, because I am a Medicare recipient, and it is not only complicated, it's challenging. So I think that people need to understand that they are their own best advocate. No one will advocate for you like you advocate for yourself. They also say that knowledge is power. And so you've been given information, and now if you have some concerns about, and you're on Medicare, you may want to call that number just to see what your options are. So I'm going to give it back to Sadia so she can get that number out one more time.
Yes, that number is 1-844-937-9464 or www.yeszing.com.
Outstanding, outstanding. Dr. Eric Whitaker, you're until next Monday.
Well, I want to join everyone in thanking Dr. Danny K. Davis for providing this forum. And it's critically important for a company like ours because, you know, we are doing things like Black people tend to do. We're doing more with less. I was just talking with someone about how much money they spend during this, one of the big companies, how much they spend during the annual enrollment period, and was informed they had a budget of $650 million for marketing. Just think about that. and we don't have that at Zing Health. And it really is going to be about us, word of mouth, and people having a good experience and you know, letting folks know, because we won't ever have $650 million to run a commercial with JJ Walker on TV. That's not who we are, and so we're going to have to depend on, you know, grassroots and information getting shared. So want to again thank you, Nikki, for this forum, and look forward to continuing to work with everyone to create great products that improve the health of our community.
Outstanding, and thank you so very much. I've got to read this text that I just got. The young lady says, "Thank you for the phone number. I have written it down. I have texted to my phone tree. My whole block knows where to call to get information. But I want to thank Congressman Danny K. Davis for my raise in my Social Security check." So
Right on.
thank you for your raise in your Social Security check. She says, now you may not have to choose between medication, since I got this information, and some groceries. So thank you, Congressman Davis. Oh, that is so sweet. Dr. Hampton, you're until next Monday.
I definitely want to applaud the entire team with Zing, Dr. Whitaker. I think you have hired a very talented marketer, because she did a whole lot of marketing tonight with that phone number. So we know she is skilled in that art of marketing. But, you know, it's clear that you guys have made some sacrifices to provide all the services you do. But it really makes me understand that the future of healthcare is now. You know, you had me at continuous glucose monitors. I mean, people not having access to that, it's a crime. It's a great technology, and it really does help people figure out not only how to manage their diabetes, but in the world I live in, reverse their type 2 diabetes, and for the type 1s to manage it more effectively. So I want to say the future is now. I think this ideal of behavioral health and having access to that is critical. I would argue that is one of the biggest barriers to people finding success. They struggle with all of these behavioral health issues, and they just can't get their brains right. So we need to support them. Access to food is huge, and being able to provide $50 may not seem like a lot, but if you shop like my mom used to shop, that goes a long way, and you can do a lot with $50. So I appreciate that. But most importantly, having an organization that addresses social determinants of health is huge, because what I've found is that people who are successful are not successful if you don't figure out why they struggle. So if you have an organization that's focused on the struggle and provide a path past the struggle, that is huge. So I really appreciate all you guys are doing, and I think our communities are blessed to have you guys.
Thank you so very much. Congressman Davis, as always, take us home.
Well, you know, this has been such a positive experience, and I want to thank all of you for participating. The one question that continues to linger, of course, is when do we reach the point where everybody in our country has access to the health care that they need? And while it may take a long time to get there, I think we're well on our way. Just thinking about the progress that has been made in the last decade, or thinking about the creativity that Eric has put together and come up with, and to have on the market and in the marketplace. And it does take a lot of resources, a lot of money, a lot of effort, a lot of everything that you can think of. But you know, I was listening to the news, and each one of the candidates in Georgia running for the Senate spent more than $200 million on their campaigns. Just $200 million. And neither one won. Nobody won yet. So if we can invest that kind of money trying to get the outcome that we're seeking and looking for, we can put the money together that ultimately, and I want to thank those who called in terms of especially the lady who made the point that everybody on her block is going to have the number, is going to have the information. I mean, when you hear that, that lets you know that progress is on the way. And as Reverend Jesse Jackson would say, keep hope alive. And so as long as you can keep hope alive and bring together the efforts to show its movement, it certainly gives me a great deal of hope. So I want to not only congratulate, but I also want to thank all of you for being a part. And for some reason, I thought of Dr. Daniel Hale Williams. I thought of Dr. Charles Drew. I thought of Valerie Jarrett's father, Dr. Bowman. I thought of pioneers, Dr. Effie Ellis. I thought of Black physicians and scientists who have contributed so much to where we are today, until I'll have nothing but a salad when I get home. Have a wonderful evening.
You're making
I'm
Dr.
learning.
Mason smile. Dr. Mason is smiling.